So gum disease is something which is very difficult to slow down, and gum disease, as you know, is loss of the bone around the teeth. So even though we call it gum disease, it's more the jawbone that is actually falling away or receding. So when people get gum disease, what it is in summary is that the bacteria that normally live above the gums start to burrow under the gums, and when they form a colony of bacteria under the gums, what they will do is start to multiply. When we brush or when we floss our teeth, we're basically cleaning most of the time above the gums. So if the bacteria is living under the gums, what they will do is over time start to form acid under the gums, and it will start to cause the bone to dissolve around the teeth. This can be sometimes very localized to maybe 1 or 2 areas of the mouth, or it could be very general where it's all of the teeth. And again, when this happens, it's how quickly this progresses. Of course, it can be limited, as in we can slow the progress of the disease by actually removing the bacteria. And this is when a periodontist or a oral health therapist or hygienist or dentist cleans the bacteria from under the gum, and the gums actually then seal back to stop more bacteria and food getting under the gums. However, if the bone drops too far, what we end up is a pocket. And a pocket basically means the height of the gum to the bottom of the bone. And this pocket, of course, the deeper the pocket, the deeper the bacteria. The deeper the bacteria, the harder for a patient to clean and harder for the dental professional to clean. So if the pocket is very deep, what we will find is the disease will continue over a period of time. One of the things we see is when a patient comes in and says, I've been getting my gums treated for years. I occasionally lose a tooth every 6-12 months or so. I know that there's still some active pockets, which means active bone loss occurring. Other areas are stable, but I really hate my smile and I'm not eating my food well. And it becomes a time when a patient has to decide on whether they would like to seek long-term treatment with their teeth. It is very much up to the patient, as in the timing of treatment. However, as you understand that bone disease or gum disease is a loss of bone, long-term treatment is either dentures or dental implants, and this is usually replacement of the teeth. If we lose a lot of teeth, it then may be partial dentures. If we lose all the teeth, it can be full dentures. But with dental implants though, we need bone in order to place dental implants. So if the bone drops too far and we lose too much bone because of the gum disease, sometimes dental implants are not even possible. So one of the most important things is timing of treatment. We have to analyze patients' bone and gum and decide on when is the appropriate treatment to do dental implants, if that's an option that patients want to look at. If it's dentures that patients want to look at as their long-term option, then holding on to the teeth as long as possible is usually better than having the dentures. The kind of middle ground here is that if the gum disease is causing systematic issues, and systematic issues of course or systemic issues is based around the fact that we know the bacteria is causing inflammation, we know patients are swallowing the bacteria, we know there's a link to cardiovascular disease, type 2 diabetes, low birth weight, babies. There's so many links between gum and possibly even problems with health, as in the mind health, as in dementia. If there is a link here between general health and gum disease, then of course this could also mean that we need to address this earlier. But what I say to patients that have had a long history of gum disease is that it may be important to address this if they are considering replacing their teeth with dental implants, because if the bone drops too far, we may not be able to do this treatment for them.